Today I'm going to start my preparation journey for MCCQE1 exam. And first of all, a brief introduction about myself. My name is Dr. S.J. and I am an international medical graduate from Pakistan. And I have GMC registration that I got recently in the last year. And I was willing for GP training from UK, but unfortunately because of this prioritization bill, it's I think it's getting difficult nowadays to get into training as the rules have changed. So let's embark on a new journey, and I hope like anyone who is in the same situation like me, they can benefit from this series. I will have a series of sessions for preparation of MCCQ1 exam. Just to tell you guys what is MCCQE1 exam. It is a licensing exam for practicing medicine in Canada. It is just one of the requirements, and after that we can get LMCC. That is just a license from Medical Council of Canada. So actually, first I was thinking that I want to pursue my career in UK after getting GMC registration, but now as I feel that the things are changing and times are evolving, so therefore I decided that I should make up my mind to go on an alternate route. So anyone who want to be with me, who want to share the journey with me, you are more welcome to join me. So let's start with first thing first. So I went on Medical Council of Canada website, and there I saw some list of objectives, or basically the key objectives for this exam, and therefore I downloaded those objectives. And today, in my first session with all my medical colleagues who want to appear in QE1 exam, I want to give you a brief idea of what should be kept in mind while preparing for this exam. So first thing first, here you can see on my screen the table of contents that I downloaded from Medical Council of Canada website, and there are so many topics that you can see, and they are organized alphabetically. So I will click on these topics and you will see what is needed to be done and what we should learn from these topics. So first topic I could see is abdominal distension. So they have given very briefly that what does it really means, and what are the causes of abdominal distension, like ascites, very important, bowel dilatation, and other causes like mass, irritable bowel syndrome, organomegaly, and pelvic mass. So whenever we are going to see such topic, while preparing for this exam, we must keep in mind that we need to learn the causes of abdominal distension. The history is very important, and as you can see here, and physical examination is also very important. And then we have to see the investigations and imaging techniques, lab investigations and imaging. Everything is very important. Yeah. So we will focus on basically management of patients with abdominal distension, starting from history and physical examination, investigations, lab results, and then finally the management or treatment. And the management plan should include like specific therapy, like in case of ascites, like dietary, medicinal, pharmacologic therapy, and therapeutic. So we need to learn all these steps. Okay, the next topic I can see here is abdominal mass and pelvic mass. I will go through it briefly. That basically they want us to know what are the causes of abdominal and the pelvic mass. This includes gastrointestinal masses like tumors, infection, inflammation, and tumor. Are the three main causes we should keep in mind. So anything related to infection, inflammation, tumor, basically present in the GIT area, that is the gastrointestinal area, or the genitourinary area, that includes the urinary tract. So we should keep those causes in mind. And then some other causes, like maybe endocrine causes, like neoplasms and tumors and lymphatic systems and vascular and abdominal wall causes. So again, they expect Medical Council of Canada expect us to know about the history, the examination findings, the diagnosis, investigations and management, and include not only therapeutic but also preventive medicine as well. And so basically, we need to know very important things related to these topics. So after discussion with you guys, now you clearly see that these topics need to be learned. That we need to know about the risk factor, the causes. Then we need to know about the history findings, examination findings, then the management plan. And the management plan not includes only the therapeutic aspect but also the preventive aspect. And so basically, intervention, then we have to see whether we need to treat it in the primary care or the secondary care, or a referral is needed. So, and monitoring is also very important. So just to tell you guys that I'm not going to keep your mind very occupied. We will talk in between as well. So just to let you know, guys, that before starting my registration pathway from UK, GMC registration pathway, I appeared in QE1 exam back in 2021 for the first time, and unfortunately I could not make it. The passing score was 226 and I got 225. I know that was quite frustrating because I failed with 1 mark. But the thing was, like, I did not have an idea what was really needed to be learned for this exam, because there was no clear blueprint that was in my mind, and I could not follow any specific Q bank and then specific book, and maybe there was some problem with my approach as well. And now therefore I decided that maybe I can try a different route now, and then I started my GMC pathway. But again, look, my fellow colleagues, my doctor community, the my GMC pathway did not work well for me. And basically, I'm not willing to have any non-training roles for long period of time. Like NHS want us to have a non-training role for 5 years, and then they will allow us for the training. So I basically jump into the training straight away, because I'm not a very young graduate. I'm very like, I'm in a middle age graduate, and I don't have enough time for all this. So therefore I decided that maybe it's the time to change my route again and start preparing for QE1. So I have a little bit experience with me, how was the exam and what appears in the exam. At that point, I must tell you guys that I did not have an idea that there would be some MCQs related to history as well. I thought that history would be asked. They ask about history only in the NAC OSCE part. But after appearing in the exam, I thought, yes, I was mistaken. There were certainly some MCQs from history as well. I want to just make you sure that you guys just keep in mind that whenever you read any book, any literature related to this QE1 exam, focus on all these aspects like history, examination, lab investigations, blood work, and then finally the management, therapeutic, preventive, and monitoring as well, and the referral program as well. I hope I'm making some sense to you guys. Okay, now moving forward, today we are going to briefly read all the MCC objectives, and then we will proceed from it further tomorrow. And I will have these sessions daily, so be with me and learn something. While I'm a student too, I'm not an expert, but if you are with me, definitely we are going to make it together and our journey will become easy. Okay, now the next topic seeing here is chronic abdominal pain. The brief definition of that, and then the causes. Causes are very important. Like as we already know, that abdomen can be divided into many quadrants. So we have to learn about the causes of abdominal pain in all these quadrants, and some in other conditions that are basically pertaining to these organs, and then some general conditions like allergies and constipation and musculoskeletal. Then we have some more objectives like findings, history, examination, and these things are constantly repeating as I can see. And management plan, then medical plan, the surgical plan, the non pharmacological or non therapeutic plan, and the preventive plan as well as monitoring. So all these things need to be kept in mind. Same goes for acute abdominal pain. First, the causes depending upon the region, then causes of diffuse pain, history, examination, investigations, and a clear management plan, including the therapeutic plan, the pharmacological plan, non therapeutic plan, the surgical plan, and for all these conditions is very important. Then they say we have to learn about abdominal pain in children. So again, the causes depending upon the region, and then again history, examination, investigations, and the management definitely. So look, guys, I am trying to make things simple for you, that after learning these objectives, I can see that we have to focus on all these points. And my source of study would be Toronto notes, and I will read Toronto notes one topic, and then definitely we are going to solve some MCQs of that topic. Okay, so from tomorrow onwards we will look into the topics and the MCQs together. So next topic, as you can see here, is anorectal pain. Anorectal pain, again, some causes like infection, inflammation. Always keep in mind infection, inflammation, neoplasm. Never ever forget it. Okay, and trauma. One more thing you can add: infection, inflammation, trauma, and tumor. So infection, inflammation, trauma, tumor. IITT. So some mnemonics I can generate spontaneously that can help you and me as well to remember these things. So infection, inflammation, tumor, trauma. Four things. Then again, I can see here that they want us to know about the history, examination findings, lab investigations, management, including the medicinal management, the surgical management, the prevention is very important, and referral and monitoring as well. So I hope, guys, I'm making some sense to you, that until we have learned objectives of few topics, and I can clearly tell you that what should be we keep in mind while reading Toronto notes. Toronto notes is one of my biggest fear, and I really don't understand why is such boring, I should say, or such book that I'm never friend with that. But now I must say that Toronto notes might be very important for while preparing for this exam, because it is according to Canadian guidelines, and we have to read that whether we want to read it or not, but we have to read that. So we will read it together, don't worry, guys. From tomorrow onwards, we will start reading Toronto notes. And there are big 9 chapters in Toronto notes that we will really focus upon them. But for now, I will tell you all these 9 chapters at the end of this session. So let's carry on with the objectives. Abnormal heart sounds and murmurs. Again, the causes of systolic murmurs, the diastolic murmurs. I really fear them. Difficult to retain, but we have to learn them somehow. Then investigations and management as well. So abnormal lipids, again, the causes, lots of causes I can see. Then objective for history, examination, and management. Abnormal LFTs, like causes, keep in mind, then history, investigation, examination, everything. Okay, carry on. Abnormal pubertal development, that's something new. What do you want us to learn in this topic? So puberty, okay, yeah, everybody know about puberty, but what they want us to know about some abnormalities in puberty, like causes, delayed puberty, precocious puberty. Wow, some fancy terms are here. And then we have to learn about the causes, the history, investigations, examination, and management again. Okay, acid-base abnormalities, metabolic acidosis, metabolic alkalosis, metabolic acidosis, metabolic alkalosis. I can see it looks like a lot, but definitely, guys, we will learn just the major things. I am looking at these objectives so that when I open Toronto notes, I am focused what to do and what to skip. I cannot retain each and everything written in Toronto notes. Honestly speaking, it's impossible for any one of us. So now, history, oh yeah, they want us to learn about ABGs. Okay, understandable. Then, adults with developmental disabilities. Okay, so they want us to learn about certain syndromes. Oh yeah, genetic syndromes looks important. Autism spectrum disorder, brain injury, alcohol spectrum disorder, and some objectives like findings, examinations, investigations, and a clear management plan for that. Allergic reactions and atopy, okay. So again, it can be red and amenorrhea, oligomenorrhea from the gynae part. Okay, then primary amenorrhea, secondary amenorrhea, causes, findings, history, examination, investigations, and management plan. Then anxiety, psychiatry part. Okay, we will learn about the different types of anxiety. Wow, good. Written in a good way. We need to learn about generalized anxiety disorder, panic disorder, agoraphobia, social anxiety, separation anxiety, selective mutism, substance medication induced disorder, anxiety disorder. I hope I'm not making you guys bored. Just listen to this session, and I'm just reading for you guys just to have a small idea what we are going to prepare for this exam. Understand? I hope that 70-80% of the exam come from these objectives. I feel so. So back in 2021, I really don't remember clearly. I have not. I'm not very much sharp at memory. I cannot tell you guys exactly what came in my exam in 2021 and what will come now in 2026. But I hope that these objectives, if we try to learn these objectives, these topics well, maybe we can pass this exam after hard work. Okay. Yeah, but a very important thing came in my mind, guys. Like in 2021, when I appeared in my exam, can you believe, guys, the exam was 6 hours long? It was 3 hours for MCQ part. Roughly, I guess it was just 210 MCQs or something. And the second session was CDM, decision making. I hope most of you guys would know, if someone appeared in the exam before 2025, CDM was a must. But luckily, CDM is removed from this exam. A big clap, a big shout out to MCC. So that's very good. Like, when I appeared in exam back in 2021, after solving MCQs for 3 hours, constantly looking at computer screen, and I was giving exam in my home because I could not find a center at my choice place, so it was difficult to move another city. So I booked a prometric exam at my home, and after 3 hours, literally my mind was shunned and stunned, and I was totally blank because I was so exhausted. It was so tiring. And after 3 hours, it was a 15 minutes break. There was a relief. I went out, came out of my room. I had a quick snack. I drank some juice and tried to fill up my fuel for the next CDM part, which was going to last for 2.5 more hours. So it will, although the questions were not very long, the number of questions were sorry about it. So the number of questions were 40, but after I came in the room again, I looked at the screen and all the screen and what, you know what happened? My I was so exhausted that I could not understand what they wanted me to know. I read the first question. It did not make sense to me. I jumped to the second question. It did not make sense to me. I was not worried about timing part, but the things were not making sense to me. I was not understanding what they want me to do. And CDM was basically writing questions and they were really tricky to solve. So I didn't know what to write. I was so blank. Then I thought that in this way I will waste my time a lot. So better not to go on the sequence of 1 to 3. Better go to the last question, means the 40th question, start solving from there. Luckily, the 40th question was a bit easy and I understood it, and then I started solving it slowly, moving upwards. Yeah, just telling you this story so that you guys don't get bored. And luckily now we don't have a CDM part to study for, and there are no writing questions now. As you can see on the Medical Council of Canada website, since 2025 July, the rules have changed, the exam pattern is changed, and now there are only MCQs, and there are I guess there are two portion of the MCQs, and roughly I am not 100% sure, but as you can double check on the website as well. But there are 210 or 220, 210 MCQs, I guess, and they can be done in two windows, and one window and the other window, and the gap or break in between, and that's really good. Okay, now coming back towards our objective part, so we learn about all these anxiety disorders. Okay, then we have to learn what is in psychiatry. I want to see exactly what we need to know: how to diagnose the condition, the cause, the severity is very important, and complications and management plan. Okay, history and examination again, then various causes, various comorbid conditions. Severity is very important in psychiatry, and investigations, and initial management plan that include anxiety disorders and psychological and all these things, and basically supportive therapy as well, and referral to specialized care if necessary. Okay, that makes sense. Next thing is ataxia. Ataxia, again, I see after reading these objectives that they have given some symptoms, and we need to learn about these symptoms, and not they have not given the exact topics. Like they have given us the symptoms, and we have to learn the causes of these symptoms, like types of these symptoms, like cerebellar ataxia, sensory ataxia, movement disorders. I know it's a part of neurology, and the neurology chapter will learn about it, like cerebellar ataxia, tumor, maybe hereditary, drugs, alcohol, vascular, then sensory ataxia, movement disorders, then history finding us. So again, the same things: investigation and a clear management plan, and reference and specialized care. Attention, learning, and school problems. Okay, again, various causes. Then basically we have to know about the findings, investigations, and management plan. Especially I can see in psychiatry topics that we have to focus not only on the therapy. Of course, the psychosocial aspect is very important in psychiatry topics. So we have to, while learning management, we have to learn about the psychological management, the supportive management, and basically the medical man. Along with the medical management, basically counseling is very important, and refer to specialized care if needed. Bleeding and bruising. Okay, so causes, then various history examination findings, and counseling again. Okay, upper GI bleeding that we must learn in gastrointestinal chapter, causes. Okay. Then we have to learn about lower GI bleeding again, causes the same thing, lower GI bleeding again, and then blood in the sputum. So whenever if I go to GIT chapter, we will focus on upper GI bleeding, lower GI bleeding. If I read respiratory chapter, we will focus on hemoptysis, causes, clinical findings, investigations, and a management plan. Oh, I hope things are making sense to you as are making sense to me. Then the next topic would be hypotension and shock. Okay, causes. Then we have basically findings, examination, investigation, management. Now we remember that all these topics need to be learned like this. Shock. Shock must be a part of emergency medicine, right? So we will learn about it. Then breast discharge, definitely. In gynecology, we learn about it. Okay, then we have to learn about what come next. Breast mass and enlargement, very important. So maybe malignant causes, non-malignant causes, and some things that we need to learn is screening. Wow, now you should remember that, guys. Please listen to this video properly so that if I forget while reading about these topics, so you can make me remember that, oh, we skip that thing, we need to learn it, like screening. So, guys, please note down that we have to learn screening. Like breast screening is important, colorectal cancer screening, and maybe some other tumor screening. I'm not sure right now, but screening topic is very, very important because I remember definitely MCQs come from this topic and we have to learn it. Okay. Okay, guys, so I will also note it down that we'll focus on screening while reading about these tumors. Okay, then brief resolved unexplained event, brew, previously known as apparent life threatening events. Okay, this is something new for me. Brew and all tea. Wow. Okay. So life-threatening events involving infants are devastating to parents, caregivers, and healthcare workers alike. Okay, so they talk about cyanosis, some symptoms which are very disturbing to the parents. So that's definitely a pediatric topic. And when we learn pediatrics chapter, we will focus on this topic like life-threatening events, causes include choking episode, infections, cardiopulmonary abnormalities, some neurological abnormalities, child abuse, metabolic disorders. Okay, understand. Actually, guys, keep in mind that Canada has lots of focus on ethics and abuse, child abuse, elderly abuse, child neglect. These are very, very, very important topics. Screening, all these topics are very important and we need to focus on them. So guys, I am also noting down that while reading Toronto notes, we will focus on topics like child abuse, elderly abuse, and screening, three main topics. And then other objectives in the child abuse, in these child conditions we need to learn about is history, examination, and risk factors are very important. So in pediatric, risk factors are very important, right? Then the management of all the conditions related to pediatrics. Then burns. Okay, the causes may be thermal, electric, chemical, and radiation. Okay, as I can assume that burn topic will be written in emergency medicine, so we need to learn about various types of burns depending upon the burn's thickness or extent of burn, and then risk factors, and then specialized management plan, like how we have to stabilize the patient. Okay, one important thing came in my mind that if we are dealing with an emergency, we have to stabilize the patient first. I repeat, if we deal with emergency in this exam, that is an emergency life threatening situation, we have to stabilize the patient first. Means that we have to look ABC. We have to clear airway, breathing, maintain breathing, check circulation, first thing first, and then we will go towards the specific management, right? Like in the case of burns, we have to stabilize the patient, and then we have to give IV fluids, or if there is a wound is there, we have to do the wound care, pain control, and determine whether the patient requires specialized care or complications. Now let's talk about the calcium disorders. Okay, so again I assume they must be in the emergency medicine chapter, or maybe endocrine chapter. Causes of low calcium, high calcium, very important. Then we have basic history, examination, investigations, and a clear management plan also needed. Cardiac arrest. Oh, big shout out to the cardiovascular chapter. That is very important because cardiac arrest nowadays is a big topic that we need to learn. Okay, so this is basically can be a good topic for emergency medicine as well. Cardiovascular accident and transient ischemic attack means a stroke. Okay, for neuro chapter, emergency medicine, then chest pain again, and then clinical informatics. What is that? Let's talk about it. Informatics. Health informatics is the study of information design and use in healthcare. Clinical informatics is the application of health informatics knowledge in the clinical setting to promote quality care. Digital health is the use of information technology and electronic communication tools, services, and processes to deliver healthcare services and facilitate better health. So the use of EMR technology, the virtual care, artificial intelligence, machines. So basically IT technology and health side by side, that is health informatics. Okay, so basically digital care is a modern era of digital care, virtual care, and then we have to know about certain technologies, especially EMR. That is very important. That is really useful technology used in Canadian healthcare system. Always keep in mind EMR, that is electronic medical record, and EHR, electronic health record. These two things are basically very important, and they are used in Canadian healthcare system. Then picture archiving and communication system, picture archiving and a communication system, and lab informatics system. So all these things are important. Then virtual care, and then we have all these things that we should keep in our mind. Then the topic of coma. Coma is must be in the neurology chapter. Causes and management. Then congenital anomalies, dysmorphic features in pediatric chapter. Teratogenic disorders, genetic disorders are very important in pediatrics, no doubt. We need to learn them. And then constipation. So I am the important topics that we will forget about them. I am writing them on a piece of paper side by side, and I will also tag them in this video as well. Okay, then adult constipation causes, and then there must be a topic of pediatric constipation. Then the next topic would say contraception. Yeah, gynecology. Contraception is a very important topic, and the hormonal methods and non-hormonal methods, non-permanent and the permanent methods. And then we have to learn about the risks of failure, complications, indications, contraindications. All these are very important. Contraception. Then in the respiratory chapter, cough and causes of cough, examination, investigations, management, everything. Crying or fussing child. Okay, then we have cyanosis and hypoxia. Okay, Then next would be delirium. Okay, I understand delirium is a very important topic because it's something related to elderly care. So geriatric chapter is very important and a must to do thing for QE1 exam. Okay, then we have next thing is developmental delay in pediatrics. Developmental delay, that is very important. Then acute diarrhea, these are basically GIT situations, acute diarrhea and chronic diarrhea. So definitely we are going to get some questions out of that, and the pediatric diarrhea. Then we have what next, diplopia. Okay, ophthalmology, we will do few topics like diplopia. Okay, then causes important, investigations and management. Dizziness and vertigo from ENT chapter, causes are very important. Investigations, management, dying patients. Okay, so what is meant by dying patients? We have to learn that end of life care. Okay, I'm writing down end of life care. That is also a very important topic that we need to learn for QE1. Okay, then dysmenorrhea from gynecology chapter, dysphagia from GIT, and then dyspnea from respiratory chapter, dysuria, urinary frequency, urgency, and pyuria from the urinary system. Okay, ear pain, othalgia or ear pain causes and everything. That's important to know. Next is we have from gynae chapter, option gynae chapter, early pregnancy loss or spontaneous abortion, the causes. Yeah, this abortion topic, then findings, then we have important investigations and effective management plan. All these things are very important. Generalized edema, although it's a very just a symptom, but the causes may be heart failure, pregnancy, and liver cirrhosis, renal disease, and nephrotic syndrome. All these things are very important, we need to learn about them. Although I think that this topic is quite scattered everywhere, but we need to focus on that. Then localized edema like DVT, trauma, lymphedema, infection, inflammation, and then we have to learn about the history, examination findings, and the management plan, right? And specialized care. Eye redness. Okay, ophthalmology. Few topics are important. First we read about diplopia, then eye pain, and now next thing is failure to thrive. That is very important for pediatric point of view. Causes are very important, and then we have falls. Okay, in elderly or geriatric chapter, end of life care is very important, and falls topic is also very important. So causes of falls and how to prevent falls, that is also very important. Okay, fatigue. Fatigue, all this is a general term, but is especially related to some endocrine disorders and psychiatric disorders, and so fatigue can be a very versatile symptom. So we need to learn more about that, or maybe a simple chronic fatigue syndrome. Frailty in older adults who have varying degrees of weight loss or malnutrition, cognitive impairment. So in elderly or geriatric, we need to learn about end of life care, falls, and frailty. That it means frailty applies. Frailty in adults, in elderly basically. Frailty in elderly, that basically pertains to weight loss or malnutrition. So today, I guess frailty is quite a new term for me. That simply means weight loss or malnutrition. Frailty means weight loss or malnutrition. We should remember it. Okay, then maybe cognitive impairment. They have different, because with age, age is accompanied with lots of diseases, comorbidities. So that's why I think causes are very important. Some diseases, medication, polypharmacy is also a very important topic in geriatrics. There, because there are certain medications for various illnesses, pharmacological, non-pharmacological management, community support, psychosocial support is also very important for elderly. Gender and sexuality. Okay, so Okay, LGBT is also a new topic, and we need to learn what are the risk factors and the management for these LGBTQ PTQ groups, some genetic conditions. Then we have headache is an important topic, and definitely we need to learn about the primary headache, idiopathic or primary, and then the secondary headache. And we need to learn about the symptoms, investigations, effective management plan, and preventions and monitoring and referral. Then hearing loss. Okay, for ear this topic is important, hearing loss. And you need to learn about various causes and management. Hematuria, again causes and management. Anemia, okay, for hematology anemia is an important topic. And elevated hemoglobin, polycythemia, again important topic. Then hernia, that's for surgical point of view, that is a good topic. Then hyperglycemia, I understand that must be learned. And then hypertension, okay, of course everybody in work as a GP need to know about all these topics. Okay, so I'm trying to be as quick as possible because the session is getting very long, so at least we have a very good idea that what we need to learn. And now I'm just quickly looking at the things, hypertonic infant, and then fecal incontinence in adults. So incontinence in adults and children and in uresis is very important topic for pediatrics. Infertility, definitely a need, we need to learn about this from gynecology chapter. Intrapartum and postpartum care, very important. Okay, moving forward, so let's go forward. Okay, so next topic I would like to discuss with you guys would be jaundice. Again, very important, we need to learn about it, causes and everything, legal causes, investigations, management, treatment, everything is very important. Okay, so after having going through, skimming through these objectives, now I think most of you guys would be clear just like me that these topics, we need to, what we need to learn from them. Like I have repeatedly told you that in etiology, cause is very important, risk factors very important, history, physical examination very important, and the management plan is very important, right? And referral and prevention is also very important. So let's go to the top of the topics, and the initial, we have a good list of the topics. So if you just read a chapter like from tomorrow onwards, I'm going to start with pediatric chapter. Okay, so after reading the topics from the pediatrics, I will just focus on these topics mainly, and a quick review of other topics as well. But pediatrics, like as we saw here, constipation, crying or fussing child, cyanosis and hypoxia, and some developmental disorders and failure to thrive in child, and hypotonic infant. And then we have developmental disorders, then genetic disorders, definitely. And then pediatric respiratory distress, newborn assessment, very important, newborn preventive health is very important topic, we need to focus on that. So my list should also include preventive health or newborn assessment or periodic health assessment, that is also very important. Okay. Okay, guys, so newborn assessment, pediatric assessment, immunization, and then we have to learn about, yes, I remember, and uresis was a very important topic. And then, as you can see, there's a big list of population health and determinants. That is basically good. These topics are very well written in Toronto notes according to Canadian guidelines, and we are going to learn about that in topics called public health and preventive medicine in Toronto notes. Definitely we are going to discuss it together. Okay, and then we have some other things like for pediatrics, I think the topics that I told you, they are very important in hypothermia in infant, child fever in infant, and then Child abuse is very important for pediatrics, and then some other things like child abuse, as you can see again here, violence, abuse of elderly is also very important. Okay, and then all these topics are very important for pediatrics point of view. So after skimming through this list, I can make sure for you guys that we will focus on these objectives, especially when I read a chapter. And today, as per my promise, after this video, at the end of this video, especially at the end of this session, I am going to talk about important 9 chapters from Toronto Notes, guys. So please note down. Number 1 chapter important from Toronto Notes, that is a must do chapter, is Pediatrics, then Psychology, then Obs and Gynae, then Family Medicine, then Emergency Medicine, then Public and Health and Preventive Medicine, then Ethics, and last but not the least, Geriatrics. So these are 10 important 9 chapters from Pediatrics. I will also give this list in this basically session, and I will write it down for you guys so that you can just copy it and keep it with you. And also some topics that are need to be must that are very important for this QE1 exam. I will also make a list for, like I made for myself. I will write it down for you guys as well, along with this video, and tag in this video. And then you can also focus on these topics like child abuse, elderly abuse, screening, health informatics like emergency medical record, or electronic medical record system, EMR system, or electronic health record system, that is EHR, genetic disorders. And then for geriatric, certain topics like end of life care, falls, frailty in adults, and for newborn assessment and pediatric and developmental disorders and developmental delay for pediatrics. So I will also make a list for these things, and I will put in the caption. And basically guys, just copy it, and this from tomorrow onwards, hopefully, inshallah, we are going to start with the first chapter from Toronto Notes, that's called Pediatrics. Hope to see you tomorrow, guys. Have a nice day, and feel free to ask any questions. And I'm going to also make a WhatsApp group. You can also contact with me on WhatsApp, and these are absolutely free sessions, and whoever need these sessions, basically it's a journey that a person alone cannot be, journey is not easy when a person is alone. So therefore I want to have a community, a family, a group of professionals who are on the same boat like me. And so we will start the journey together, and we will reach our goal, inshallah. So with Allah's will, we will definitely reach our target. And for now, I'm going to sign off, and get ready for an interesting next session tomorrow about pediatrics. Okay guys, see you soon. Take care, and don't forget to subscribe to my channel, and so that I can upload more videos for you. And if you like this video, please give your thumbs up, and like, subscribe, and share among your friends. Okay, have a nice day guys. See you soon. Take care.